Hi folks, Mike here again, and today I'm actually going to be paying the final bill on my laser vision correction surgery. And that got me to thinking, I think it's time to let the world know what it's really like to not have health insurance. Now before I start, some housekeeping. This laser vision correction surgery cost me $5,400, roughly. I paid for this in installments over a period of 48 months, so $5,400 divided by 48. There wasn't any interest, there weren't any late fees, this wasn't a note issued on a discount, so there was no incentive for me to pay the bill all at once, so long as I was able to make these installments every month and on time. Right now, I don't have health insurance, but that misses the point. When I had this surgery done, I did have health insurance. I had very, very high-quality health insurance, and it didn't cover this surgery. In fact, because it's an entirely elective surgery, almost no health insurance covers it. So I'd like to point out two things about that surgery. Number one, specialized facilities specific to this surgery were readily available to me. Number two, I told you the price of $5,400. Well, a few things about that. Number one, that covered 3 preoperative visits. That covered the surgery itself, and it covered a year worth of postoperative visits, including regular vision checkups. And number two, that number is a fixed number that you can call in today and get from them over the phone in under 3 minutes. This isn't something where the candidates get charged differently based on the condition of the candidate. They have a set price, and if it takes a little bit more work than it normally does, they eat it. And if it's a much easier surgery than normal, they make money on it. Just like any mechanic would when they give you an estimate for labor and for parts when working on your car. Now, I realize some of you are going to say, a car and the human body are not the same thing. The human body is a significantly more complex thing than a car. Well, the point is moot when you have something like laser vision correction at a flat fixed rate that they can tell you up front before they even conduct the surgery. All there is a screening process to determine if you are a qualified candidate at all, and then there's one fee for the surgery, which they tell you up front. So that's something that if you were to extrapolate that to simpler surgeries, by the way, where you're working on bones and not an eye, for crying out loud, you would certainly expect that you should be able to make that estimate for, in this case, labor and materials for a much less complex surgery. The thing is, if you go into a medical office and say, if I broke my wrist in this certain way, with these certain conditions, and with me as a patient, who you know well, because let's say it's some doctor that you know well and they have your records and they can look up your records on an instant, what would it cost? Well, the answer is going to be, we can't possibly tell you anything from 0 to infinity. Whereas with laser vision correction, no insurance, they can tell you that price up front. My vision was corrected to roughly 2010, so I have eagle eyes. And by the way, what a decision it was to spend that $5,400. Just as a quick aside, if you are considering getting laser vision correction and you want my opinion on the matter, I would say it was the best $5,400 I have ever spent in my entire life, and it is a world-changing experience. But getting back to the main point, what it's like to not have health insurance. Well, okay, then let's talk about a surgery that's not like working on your eyes. Previously, I gave the example of a broken wrist, where if you call in now, they won't be able to tell you what that price is. But you would think that if you're comparing orthopedic surgery to ocular surgery, the one that would be significantly less complex is the one that would be working on the body part that is significantly less complex, a bone. Not your eye, which even among scientific communities is still an incredibly complex organ. The reason I offer the wrist as an example is something that we will get to in just a moment. Now let's go back in time, and I'm going to do this in a little bit of a reverse order. Most recently, when I did last have health insurance, it was roughly $550 a month. Now, it was very, very good health insurance coverage, but it was $550 a month, and something I flatly could not afford if I had to pay it out of my own pocket directly. Let's go back in time a little bit before that. When I last was uninsured was in my early to middle 20s, and for a great period of my 20s in general. When I left TruGreen in 2008, I was offered the opportunity to COBRA onto my existing health insurance policy, which, by the way, was the worst health insurance policy that group could possibly have attained before the ACA. So I have to tell you, this health insurance policy was god-awful, and there's no other way to describe it without cursing. That plan, folks, would have cost me $230 a month, so I opted out. Now, what benefit did I gain from this? Well, number one, I'm not paying $230 a month. And you might say, well, Mike, then how on earth do you manage to pay your medical bills? Well, for one, I was in my early 20s and in magnificent shape. And I happen to be a person who has hit the genetic jackpot when it comes to ailments. I have no major allergies except to medicine itself, which if I'm not getting involved with that medicine in the first place, why is that a major concern? I don't have any autoimmunodeficiencies. In fact, I'll go so far as to say I kind of hit the jackpot with that too, because my immune system is freakishly strong. I'm the guy that goes 2 and 3 years without even getting a sniffle. In fact, I'm on one of those runs right now, knock on wood. And when I do get a cold, and when I do get the flu, which is even more rare, I'm rarely ever sick enough to necessitate staying home from work. And even on those rare occasions when I do take a sick day, I still often find my way back to work. And in the very, very rare occasions in which I find myself bedridden, I'm over most of these ailments in a day or less. So my thinking at the time was, and perhaps your thinking is now after watching this video, why would a guy like me at the age of 23 bother to pay premiums for health insurance they're not going to use? So I opted out of having health insurance, back when it was legal for me to do that. Now it's finally legal for me to do that again. But in 2008, it would have meant spending $230 a month to have cobered onto that plan, which after the passing of the ACA, was not a plan I could actually legally opt into. That means that I would have had to pay more for the same crappy insurance. And again, Mike, what happens if you have to use that health insurance? Didn't you have regular checkups? Okay, well, a regular checkup was $150. A regular visit to the dentist's office was $250. That's $400 a year if you're doing annual checkups, which in my place, since I'm under 40 and don't need prostate exams yet, and I'm a man and can't possibly get pregnant, I'm not seeing why I need to go to the doctor more than once a year. I don't smoke anything. I don't involve myself with any illicit substances. I rarely ever drink. Why would a guy like me have any need at all to visit a doctor at the age of 23, other than at most an annual checkup? The same thing applies with my dentist. So now we are up to $400 in annual health care costs. In 2 months with insurance, I've already paid those costs. And by the way, because that was a crappy insurance policy, I would not have had that entire $400 paid for through my insurance. So I know what you're thinking. Mike, what happens if you have a catastrophic emergency? And I say, you mean like if I break my wrists, suffer internal bleeding, and need stitches on my forehead to seal up a gash? Yeah, I can probably relate to that. And let me tell you what those expenses were. First things first, this type of injury is very rare, and for me, happened once in my whole life. So we're talking once every 33 years. But let's say for argument's sake, we're only talking about a 10-year period, throughout which I was mostly uninsured. And let's say for argument's sake that instead of being mostly uninsured, I was totally uninsured during that period. Well, we're going to give a best case scenario in terms of premium costs at $230 a month, because that was cheapest person to possibly insure's price before the ACA and 11 years ago. At 10 years, that's 120 months and $27,600 in premiums, not to mention the fact that I would still be paying a portion of my annual checkups despite having that health insurance. And now let's throw in the surgery, the emergency overnight stay to have my wrist rebuilt. It was a 3-day stay, and I can't tell you how many companies had their hands in their pot on this matter, from the surgery itself to all of the other ancillary services offered during this stay. My estimate from memory was that there was roughly a dozen companies. So when it came time for billing, I got handed a bill from 12 different companies, including the hospital itself, and they amounted to, folks, $30,000. I was a pissant hourly landscaper at the time, and if you think that I had $30,000 laying around to pay that bill, you are wrong, and by a lot. But because I didn't have health insurance, I had to pay the total of that cost. You would think. The truth is, because I didn't have health insurance, I didn't have to go through the insurance company to negotiate the price of these bills. Now let's consider the scenario if I had that god-awful health insurance coverage. I would still be paying at the very least a quarter to a third of that bill. So we're talking roughly $8,000, if not as much as $10,000 towards that bill anyways, in addition to the $27,600 over that 10-year period I'd be paying in premiums, and in addition to the regular checkup fees that I'd be paying, in addition to my premiums. So you can kind of see how this is already becoming a losing matter, because $27,600 plus even $5,000 puts me in the hole $2,600. But let's get even further into the details on this matter. Because I didn't have the health insurance company to negotiate for me, I could do my own negotiations, and I got the bills reduced through grants and through just general negotiations down to $9,900, approximately speaking, with most of them offering me payment plans without insurance or late fees so I could pay as I could afford to pay them. This would not have been the case if I had health insurance, because I would be dealing with the health insurance company to actually be making the payments, which means that none of those companies are obliged to offer me any negotiative leeway. And number two, which is much more important, I don't necessarily have the ability to negotiate a payment structure that comes without late fees and without penalties. In fact, since many of these facilities, including the one in question, are net 90, after 90 days, this debt could be handed off to a collection agency, and then I'd really be up a creek. So without the health insurance, over 10 years, I spent $400 times 10 years plus $9,900. That amounts to, folks, roughly $13,900 over the course of 10 years. In the other scenario in which I do have health insurance, what we're talking about is in the scale of roughly $38,000. So how on earth does it benefit me to actually have health insurance in that situation? Now imagine today, where I had the opportunity most recently to cobra into my previous health insurance plan, and this one was $550 a month. I'm not that much older, and I still hit the genetic jackpot, and I don't have any major ailments. And I still have a really, really strong autoimmune system. So why is it necessary for me to have health insurance? And what benefit would paying $550 a month to cover onto my previous plan offer me? Again, I don't smoke. I don't touch tobacco products. I don't touch illicit substances. I barely ever drink, and I'm single. What on earth am I going to run into that isn't covered by, for example, another company's liability insurance, another company's workman's comp insurance, or various motor vehicle insurances, which are already mandated? Now, I realize that my case is anecdotal, and I realize that my case is not necessarily the rule, but the fact remains the same. It makes no sense for me to necessarily have health insurance. So why on earth would I be required by law to carry something that is to my detriment as an expense? Folks, I am not a 1%er. I am not even close, and I never have been, and I probably never will be. So don't pretend like this is something where I'm of the 1%, or the proverbial super wealthy, who are trying to pass the buck onto somebody else. Because I'm not. I'm willing to own my own debts. So why am I not allowed to own my own debts? Now, I realize today, thank God, I am. But if I actually had to pay for health insurance, because that's what we're talking about, not health care, I already pay for health care, and I'm happy to do that. But if I had to pay for health insurance, I'd be in deep trouble. Again, I realize my case may be anecdotal, and I also realize that my case may not be representative of the population in general, but it's an example of a case where somebody has actually thought to question why they should even have health insurance in the first place. And I thought it would be important to reveal the truth about what it's like to not have health insurance and to be a responsible human being. So thank you for sitting through all this, and thank you for hearing my story. And if you think anyone else needs to hear my story, I encourage you to like this video and to share it so it reaches as many people as possible. And of course to subscribe so you can get notification of new videos that I release like this one. Until the next time, I'm Mike Sinello, signing off.